Hello everyone, this is Casey with Occupational Therapy here at Edgewater. Today I am presenting the Welcome to Accentuate the Positive series. 2020 was a pretty tough year, as you all know, so we wanted to make sure that we are concentrating on some positive topics as we move into a new year. On today's positivity menu is COVID-19 and rehab. So today's objectives is to learn how your ACT Signature Rehab team can help you continue to thrive in the time of COVID-19. And this is a slide about how is COVID-19 affecting you. The COVID-19 pandemic is increasing the number of older adults who are socially isolated, including both community-dwelling older adults and nursing home residents, as many countries have issued stay-at-home orders and banned visits for the nursing home residents. This has real consequences in the day-to-day lives and function of ACT's residents. Perhaps you are feeling isolated, depressed, anxious, or insecure. Please understand this is normal and you're not alone in these feelings. The good news is that we can help. This series is called Accentuate the Positive, so there must be some good news, right? Of course. As a resident of ACT's community, your rehab team can help to ensure that you are able to continue to function at your highest level. Our therapists have training in several programs that can help you to mitigate the effects of isolation and inactivity caused by COVID-19. ACT's rehab clinical programs. Current programs that we have going on is our Thrive program, which encompasses strength, balance, energy, flexibility, and mind, balanceware, chronic pain management, and vestibular rehab. As previously mentioned, one of the most worrisome risk factors associated with COVID-19 is the isolation and inactivity it can cause. Fear and anxiety related to these pandemic leaves many of our residents in a position where they do not feel comfortable doing many of the activities that they otherwise enjoy. Replacing these activities with inactivity can lead to the physical and cognitive decline that we described earlier. ACT's Signature Rehab has several programs that are specifically designated to address these areas of potential decline. So we're going to go ahead and dive a little bit further in some of these programs. So the first one we have is Thrive. Thrive is the signature ACT's rehab program. It is designed to actively improve the overall health of our residents. This is a proactive program that incorporates risk-based assessments in order to customize rehab interventions to each individual resident based on their needs. We think this program is especially important these days as each of these 5 core components are threatened by inactivity and isolation. Our therapists would be more than happy to help you combat these risks by screening you for deficits in these areas. So Thrive Mind. Thrive Mind is a new focus program from ACT's Rehab that focuses on building residents' cognitive reserve. Cognitive reserve is our brain's ability to face different types of damage, deterioration, or illness, and maintain cognitive function, which results in little to no decline in executive functioning skills, completing daily living activities, relationships, and social and emotional engagement. This is a proactive way for us to fight the effects of aging on our cognition. If we increase cognitive reserve, people can function better in the presence of normal aging and/or pathologies. Balanceware. Balanceware is the balance that you wear physically. It is a vest that has very light weights inside that are strategically placed by a trained physical therapist to help correct imbalances in the body. The vest can be worn over or under clothing. A vest under the clothing can be much more discreet and easier to manage than a big walker. The vest is designed to provide input to the brain to correct for muscular imbalances, which can lead to falls. This program is set up following testing and consultation with a balanceware trained therapist. And this is just a picture here of what one of the balance wear vests look like. The chronic pain program is a combination of individual PT or OT sessions 2 times a week in conjunction with group sessions over the course of 8 weeks. Pain is a normal, even good, and perfectly natural way to protect you from further injury. However, chronic ongoing pain is not normal. This program helps to identify the causes of chronic pain and help participants overcome them. In a study of 75 participants across 15 ACTS communities, we found a 53% improvement in reported pain ratings. Wouldn't you like to feel even 50% better? Vestibular rehab. ACTS vestibular rehab program was designed to help determine the root cause of balance issues and address those that are caused by issues related to our vestibular system, as opposed to a muscle strength or stamina issue. The vestibular system tells the brain that you are moving, spinning, going up and down, or accelerating. If your system isn't working well, you might get confusing messages causing the brain to think that you are spinning or your brain is not getting enough information, causing you to lose your balance. Therapists trained in vestibular rehab can help assess your vestibular system and recommend simple exercises to help you move your brain along toward a full recovery. In some cases, a therapist can fix a vestibular problem within 1 session. There's more. While there are many ways in which COVID-19 pandemic has put all of our lives on hold, we want to make sure that all of our residents are in a position to thrive in 2021. If you feel limited, fatigued, scared, or otherwise not yourself, consider reaching out to one of your rehab team to participate in a screen. We feel confident that we can help you thrive. Thrive screens are the best way to see how much recent sedentary lifestyle and or COVID restrictions have actually affected your life. If there has been a COVID-related decline, it is reversible, and the sooner it is addressed, the easier and more effectively it can be reversed. Why not now? Rest assured that our teams are taking every precaution to maximize your safety during this time. We utilize proper PPE, test our staff weekly, clean thoroughly between treatments so that you may feel confident that rehab is safe in a sanitized environment. At ACTS Rehab, we talk a lot about being proactive. When you can take advantage of opportunities and stay prepared, you're more likely to have a great outcome. As I mentioned earlier, 2020 was a rough year. 2021 can be much better if we take advantage of the time that we have now to be prepared for all things that we will do later in life. Give us a call or stop by the rehab suite, which is located behind the auditorium on the 2nd floor, and we would love to chat with you about how we can get you through this pandemic much stronger than when we started. If you have any questions, please don't hesitate to reach out to the therapy department. Our phone number is listed under ACTS Physical Therapy in your directory. You can also stop by the Outpatient Rehab Center, which is located on the 2nd floor behind the auditorium. We hope that everyone is staying safe, and we look forward to seeing you soon.